Rehabilitation care is care that can help restore, maintain, and improve the quality of life following a hospitalization. Salina Regional Health Center's acute rehab unit is specifically trained to help aid in that recovery process. Dr. Owings, we'll start out with you. What is rehab?
Rehabilitation is the action of restoring someone to their home or to their previous life and function. Oftentimes in life we have various injury or illness which compromises us either in a way physically, mentally, or cognitively, causing some type of impairment. And rehabilitation is the care and the process that goes into regaining that impairment or that loss of function.
And it's probably different for every case, but what is the goal of rehab?
You're exactly right. It's completely different in every case. It's a very individualized program. We have a large care team, and each of the individuals in that care team are looking at a particular part of whether it's an impairment or a functional deficit. So we have to look at, okay, what are our achievable goals? Probably most importantly is we have to look at the goals of the patient. We have to look at the goals of the family. And we have to look at what do we feel like we can do to be able to get them hopefully back to a point in their life where they're independent.
Ashley, Dr. Owens mentioned the team. Maybe the best way to talk about the team and the services is to take it through maybe a typical day.
When the patients come over to our unit, we expect them to work 3 hours of intense therapy per day. That day starts out with nursing, getting the patients up and ready for their day, assessing them to make sure that they are physically ready to do that therapy. Dr. Owings and our other physician, Dr. Carney, will come in usually in the morning to see the patients also. Occupational therapy is usually the first therapy to see the patients. They'll help with bathing, dressing, and grooming first thing in the morning, and then physical therapy will come in and see the patients. They help with fall prevention, gait training, stability to get patients back on their feet. Usually around 11:15 the patients have lunch, and then they'll have a little bit of a break, and then they'll start in again for their afternoon therapy sessions. A lot of our patients require speech therapy based on their cognitive abilities. If they lack memory, need to work on social interaction. If they have any difficulties with their speech or with swallowing, they'll see our speech language pathologist.
How does the family come into play with the rehab?
We have a care manager who does discharge planning throughout the patient's whole stay. She will assess family support, friend support, that sort of thing when the patient first comes in. And then we encourage friends and family to come into the unit and participate in those sessions with the patient. We also do structured family training that involves the whole care team, nursing, physicians, PT, OT, speech therapy. That way they're prepared to take their loved one home.
Thanks for being on the show. Thanks for watching The Pulse. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.